Hello, and welcome back to the Harmony Inspired Health podcast. Today, we're diving deep into a topic that affects every woman at some stage of her life: her hormones, perimenopause, menopause, and hormone replacement therapy. To help us navigate the complexities of this issue, or this topic, I should say, we have the incredible Dr. Anju Mathur joining us. Dr. Anju is a leading holistic and functional medicine practitioner with over 15 years of experience helping women manage hormonal health, menopause, and anti-aging through bioidentical hormone replacement therapy, IV treatments, and functional medicine approaches. She is the founder of Angel Longevity Medical Center and is board certified in anti-aging medicine by the American Academy of Anti-Aging and Regenerative Medicine. Welcome to the podcast, Dr. Anju.
Thank you for having me, Dr. Harmony. It's so nice to be on this podcast with you.
Yeah, I'm really looking forward to diving into this topic because I see so many women in my Ayurveda and acupuncture clinic who are contemplating going on HRT or who have just started. And I do work alongside one of their medical doctors who does prescribe the bioidentical hormones. And there's a lot of misconceptions and a lot of myths. So I'm really looking forward to getting into all of that with you. But let's start with the basics. Why are hormones so important for women's health, especially during perimenopause and menopause?
Yes, well, hormones, like I explained to one of my patients recently, because she could understand why she has to take the hormones. And she was a top executive in a big organization. So I said, the hormones are like a CEO of your body, because it directs most of the body functions from a higher kind of control center. She instantly agreed to take the hormones because she was an executive. So as soon as I explained to her in that terms, she could understand it. But literally, hormones run basically all the biological functions of the body from a higher level. For example, brain. It actually starts from the brain. You know about hypothalamus, your pituitary gland, which are in the brain, and they do control the different other endocrine organs. And the whole symphony of hormones is what runs the body, the show of this body with all the functions of the body, including your memory, including your mood, including your sleep, including your motivation, even, your enthusiasm for life. I mean, it's like everything, waking you up in the morning, putting you to sleep at night, making you feel like a woman, or if you're a man, making you feel like a man. So a lot of these things that we take it for granted because we've always had those things until we hit a certain age. It just is like, oh, that's just normal. But when you start losing it because your hormones are out of balance, then it kind of jumps to the top priority list of balancing your hormones.
And so many women listening to this podcast will be in that perimenopause phase of life and possibly transitioning through to menopause. So, can you explain the hormonal shifts that happen during perimenopause and menopause, like what's happening with our estrogen and our progesterone and our testosterone levels, and why we feel like we're on this never ending roller coaster of symptoms?
Yes. So when the perimenopause, now it's a very loose word, which basically means the time around the menopause. Now, when we say time around the menopause, it could be as shorter as a few years, or it could be as long as a decade. So it all depends on who we are talking about. But the perimenopause, I mean, some people call it premenopause, which I don't know what exact that definition would be, but I would think is starting in your late 30s and early 40s, your hormones start becoming imbalanced. And think the first hormone that goes down is progesterone. And when you lose progesterone, basically you lose your tranquility, your calmness, your emotions kind of go out of control because of lowering of progesterone. And the reason that happens is because of anovulation. You're not releasing the egg, you're not your anovulatory cycles, you're not ovulating. And that's when you start losing the progesterone. So that's the first hormone that goes out in most women. And then the next hormone could be once you kind of approach perimenopause and approach closer to menopause, then you start losing your estrogen. Now, in some patients, I've seen that sometimes they lose testosterone before they lose estrogen. Some people I've seen that, like when they're younger, in their 40s or mid 40s, they actually need progesterone and they also need testosterone, even though they don't need estrogen as of yet. So it's a gamut. It's like a sequential thing that happens, through your perimenopause and you're getting into the menopause and then postmenopause.
Yeah, thank you. And talking about like that menopausal transition, there is a lot of confusion around hormone replacement therapy versus bioidentical hormone replacement therapy. So, like the traditional hormone replacement therapy. So, can you break down the key differences between these two?
Yeah, absolutely. I mean, traditional hormone replacement therapy refers to Premarin, and I don't know if you know, but or people would even can imagine what the Premarin comes from. So Premarin is composed of three tiny words, which is Premarin, which is pregnant. So the pre comes from pregnant, and me comes from mares, and the last in is from the urine. So those hormones are coming from pregnant mare's urine. So obviously they're not women's hormones and they are animal hormones, so they are not part of our bodies. And then that was the Premarin, which is the estrogen. So these are equine estrogens, like the estrogens from horses, equine estrogens, also called EE. And then you have the progestins, right? The Provera, which is the progestin, which is synthetic progesterone. And so that was what is the traditional HRT that women were being prescribed for almost half a century, that they were being given this Premarin and Provera and causing a lot of side effects because this is not natural to a woman's body. So they would cause, you name it, blood clots, the liver problems, the breast cancer, or all these different pulmonary embolisms, all sorts of things happen because of these hormones which are not natural to the woman's body. Now, coming forward to present time, we know that the bioidentical hormones word was coined. It's a coined word. The bioidentical is a coined word because why did we need a new word? Because you can't really expect a woman's hormones to be present in a plant, for example. Right? People say, hey, is it plant derived? Is it animal derived? So I would say, well, how could you expect a human estrogen or a human progesterone to be present in a plant, for example, yams, right? So that's why we can't call it natural because it's not found in nature, but the raw materials that are used to make the estrogen and the progesterone is plant derived, but the hormone is actually made in the lab and it is identical to the human estrogen and human progesterone. So this is why a new word was coined called bioidentical, which means it's identical to what you have in your body. So that word caught on and everybody said, yeah, that is a good word to use. We can't call it natural because it is made in the lab, right? But it is not synthetic to the body. It's natural to the body. We said, okay, so this word was coined within last, I think, couple of decades. And we have been using that since then. And I think it really identifies the molecular structure of the hormone that you are consuming. And it is bioidentical, which means it's identical to the human hormone.
Interesting. And even a lot of supplements, like natural supplements, they're made in a lab still.
Right.
It's
Exactly.
we
Totally.
choose what we want to hear and acknowledge when it comes to our health a lot of the time. So, what are the potential benefits of the bioidentical hormone replacement therapy over the conventional hormone replacement therapy?
Benefits would be like how you used to feel when you were younger, right? So that's all we are doing. We are restoring your endocrine system to its original symphony. So everything is working together, and just like the way, we come very close to it. Obviously, we try to mimic nature. I'm a big fan of Dr. Jonathan Wright. He was the pioneer of bioidentical hormones in America. So basically, what he says, which I love, is that we mimic nature because nature was developed over, I don't know, the human body was developed over a long period of time, millions of years. So we are not going to reinvent the wheel, right? By putting something synthetic in the body that the body doesn't recognize as itself and attacks it and protests against it and creates all the adverse side effects, right? So we want to mimic nature, and these bioidentical hormones are doing exactly that and is restoring your function as when you were in your 20s or early 30s, however, at whatever age that you started experiencing the perimenopause symptoms. So you would have, if you were suffering from the mood swings, then it will restore your moods, and you would not be like cranky or snapping at people and just getting very irritated or angry. It's funny because I would see a woman from a distance and I could tell you if this person is hormonally balanced or imbalanced, right? If they snap, out of a little quickly and irrational or sometimes or whatever, then it could be a hormonal imbalance. So if you balance the hormones are up, then the whole thing is restored and the person becomes like themselves again. And this is a most common success that patients tell me, that they feel like themselves again. So when you ask me benefits, I think the benefits are you feel like yourself again in every direction that you can think of. Your energy, your mood, your sleep, your memory, all of these things, the strength, the physical strength, motivation, wanting to do something, whatever it is, all of that gets restored.
I actually think you said it perfectly because the women I do see in that sort of age bracket or that phase of life, they come in and what they all say is, I just don't feel like myself anymore. I don't know who I am. I'm snapping easily. I've got no motivation. I don't have any passion or purpose in my life. Like, that's why when I see women, it's not just about like the physical symptoms. It goes so much deeper than that because it's, relating to this sort of dharmic impact, the dharma of their life and the trajectory of where they're going and their mindset, as well as all the physical elements. And I know from an Ayurvedic perspective, I mean, Ayurveda takes all of its insights from nature. So I love how sort of it links even to that. Like technically, we could call bioidentical hormones Ayurvedic treatment as well. Like
I
really,
like that. I like that. It's so beautiful. And
yeah.
I have a deep tradition with Ayurveda. So I would love it. Yeah. Yeah, it's nature, just bringing the nature back, whatever it is. We're just bringing it back, turning the clock back. That's really what it is.
Yeah, and I mean, like we obviously use different methods, traditionally like shatavari and different herbs, like different plant medicines. And obviously, lifestyle changes, we need to be mindful of that because we are changing through that different phase of life. And I think, we are so lucky as well to be in an era where we can back things up by looking at the science of it and really understanding that side of it as well. And modern medicine and science is backing up what Ayurveda has said for years and years. From your understanding, medical doctors still prescribing conventional HRT, or is it basically like everyone prescribes the bioidentical now?
No, I wish it was true. No, not at all. I mean, the traditional doctor, the mainstream doctors only prescribe HRT, which is a Premarin and Provera. And because of the WHI study that came out in 2005, people kind of got afraid of the hormones because of the risk of breast cancer and the blood clots and the embolism and whatnot. So people are kind of shying away from the HRT. But now when they suffer, I mean, my patients, when I see my patient, they're suffering for years.
Yeah.
And it's not a short term. They have been suffering for 10 years, 20 years. They've seen so many doctors. And then nobody says, you know what, you need bioidentical hormones. Let's balance your hormones.
And so I did want to bring up that study because I know that's where a lot of fear comes from when we talk about HRT, because it was plastered like all over media channels, like HRT causes cancer and HRT has all these horrible side effects, which to a degree is very true. But through that came a lot of unqualified myths and fears. And I would just love for you to be able to debunk a few of those with us today.
Yeah, absolutely. I mean, patients, when I take them on, that's the first thing, when they say, oh gosh, I'm scared of cancer. So then I have to go over the study and explain to them what it means. So basically, the biggest thing that was like promoted in the media about the study was that it was hormones that caused the cancer, right? But the reality of the scene was that it was not the hormones, it was the Premarin and Provera, which are the synthetic hormones for the human body. And so they did not come out and say, hey, they did say they use Premarin and Provera, but they call it estrogen and progesterone. They called it estrogen and progesterone, which it is not. It's a horse's estrogen. It's not a woman's estrogen. So the equine estrogen has 5 different types of estrogen. A woman has only 3 different types. And out of those 5 types, there was only one that's common to the horse and the woman. But the other 4 are synthetic to our human bodies. So that was the reason why. And the other reason was the progesterone that they call progesterone. It's not progesterone, it's progestin, like medroxyprogesterone. It's a synthetic version of progesterone. So that causes the side effects and the adverse effects because the body doesn't recognize it as itself. So then there is obviously side effects. There's lots of side effects. And that's what was increasing the risk of stroke, of the embolisms, and the breast cancers, and the liver disease, and all of that was from that progestins, not the progesterone. So when we use natural bioidentical, none of those problems are present. I mean, I've treated thousands of patients, never seen a side effect.
So is that the same progestins that are in the birth control pill as well?
Yes, the birth control pills are also completely synthetic. The ethinyl estradiol or whatever they're using, these are all synthetic. So birth control pills are what I recommend to my patients when they ask me. I said, okay, if you're using, a lot of times when a woman gets to menopause, perimenopause or menopause, the mainstream doctor would prescribe the birth control pills to control the menstrual cycles. But that's really bad because now you didn't need the birth control. So when I am counseling the patients and advising them, I would just say, look, if you need the birth control for birth control, then yes, go ahead and use it because that's the most dependable birth control method existing today. So if you want to avoid the pregnancy, absolutely go for it. But for any other reason, please do not take the birth control pills.
So
So
what would you use bioidentical for those women who are still menstruating?
absolutely.
Yeah, okay.
Absolutely. Absolutely. Even then, for example, let's say somebody 35 years old and comes in and they have premenopause, they have mood swings, they have all these problems, then and then they need birth control, for example. They need birth control. So I keep them on the birth control pill because they need the birth control. But with that, you can still do bioidentical hormones. So I do that both and they feel terrific.
And what about the newer sort of new age birth control pills that have the dosperidone? Did I say that right? The dosperidone in it as the progesterone? What's your view on that one as well?
I haven't run across that. So I'm not too familiar. Most of my patients, yeah, I don't have any patient that was on it, but usually any kind of birth control you're on, I would just say, if you need hormones, because even when you take the progestins, you are not really giving yourself a hormone. So you are still, when you measure the levels, the serum levels of it, you can see that that the hormones are low. So when we are treating patients, it's evidence based. We're not just doing just because we feel that's the reason. No, no. We test you to see exactly what the levels are, and based on that, we treat it.
So you are saying that in a pathology test, if you're on a synthetic progesterone and estrone, you'll see low levels of hormones, but if you're on a bioidentical, you won't see low levels of
Yeah,
hormones.
absolutely. I mean, we routinely check the levels. And we want to make sure that they are in a good range and you're in the physiological range. Obviously, we don't want to make it super physiological. We want to mimic nature. So we kind of play with it to see where it is and what's the optimum for that particular patient.
Mhm. Amazing. And there are some considerations, to my knowledge, with HRT, whether bioidentical or not. And that is what I want to ask you as well and talk to you about. So, women who do have hormone sensitive breast cancers, what about those
Yes.
women?
Yeah, I mean, if you've had breast cancer, then it's a long conversation about the breast cancer. We don't want to use. There's a lot to go into that. I don't know what what you want me to cover, but I have treated many patients with the history of breast cancers, and they're doing great.
Is a treatment for them, like they don't have to go
Absolutely,
through
absolutely.
something.
In fact, I just remembered this patient that I just finished treating a year ago or something, and she was denied. She was denied the bioidentical hormone replacement because of her history of breast cancer by another anti-aging doctor, and she was miserable, literally miserable. She couldn't really couldn't live her life. She was like, Anju, please help me. I'm like, sure, absolutely. So there is versions of estradiol that you can use that is actually protective of breast cancer. And it's a 2-methoxyestradiol if you want to know, but it is almost like a gold treasure for especially people who have breast cancer. And there's not many pharmacies that make that. But I have connections with pharmacy that makes those special kinds of bioidentical hormones, and we only prescribe them that because we don't want to obviously, create any kind of negative side effects.
Yeah, sure. Thank you for addressing that. When it comes, like we've already discussed some signs and symptoms of hormonal imbalance, especially like just when women are not feeling their selves. But what are the sort of signs, other signs and symptoms of hormonal imbalances, and when a woman should consider bioidentical hormone therapy?
There could be many different ways that a person can present. For example, you can have irregular menstruation. Like you can have, some people have cycles like once every 2 months, or once every 3 months, or once every 6 weeks, or twice a month. I mean, these are all irregular cycles. So there is some imbalance of the hormones, and we want to address that, make sure that it all becomes, if they're younger. So you want to make sure that the cycles are regular, they're happy, there's no PMS. Some people get severe PMS, severe uh, menstrual cramps. Like I had a patient that was since starting her menarche, which is the first onset of the menses, she would take off 2 days out of her life. Like she would be in bed for 2 days with severe cramps, severe. She said, Andrew, I've never had a cycle where I didn't have so much pain that I had to take, I don't know, 6 Tylenols or 6 Motrins or 6 Advils a day and stay in bed and not go to work. And I'm like, and I said, so what do you want me to do? She says, fix me. And she's like 35 or 38 years old now, right? She's had this problem for 15, at least 15 or to 20 years. And I said, yeah, okay. So we just look at the hormone levels, see where the hormone levels are. And we're going to balance those out. And lo and behold, for the first time in her life, she didn't have pain. She didn't have to go pass out in her bed. And she could actually work like a normal person during her menstrual cycle. So it's very simple. It's not very complicated. Doctors try to make it complicated. It's not. It's really simple. You just need to know what the level should be, and you just kind of make it so that. And the symptoms, like you said, there's symptoms that correlate. So in the second half of your cycle, the body produces progesterone, right? And the estrogen is present throughout the cycle, obviously in a curve like fashion. But people, when they start losing progesterone in the second half of the cycle, and that could happen like this patient started at menarche. I mean, right in the beginning, she wasn't ovulating right from the beginning. And she suffered so long, but this could happen anytime. It doesn't have to, I mean, it could happen in menarche, it could happen later, 5 years later, 10 years later, 15 years later. But you know the symptoms. You know that when there is a luteal phase progesterone defect, you will get the PMS. most people come to me, they would say, I feel very irritable and I can't sleep like a week prior to my onset of my menses. So right there, it's a progesterone, it's a luteal phase defect. But then you have to test the patient. You don't want to treat somebody without testing. And then once you test them and you figure out, okay, there is a problem, and you treat them, and then you test again. So, and then we test again. Okay, now it's better. Everything is good, and the patient is happy, and they feel like themselves again throughout the cycle. And so we know, okay, this makes sense.
And so, what are the gold standard of testing for?
So the testing could be done via blood, right? You can do blood. It's the simplest, easiest, fastest. Or you can do it through saliva, or you can do it through urine. So there's all three types available now. It wasn't available about 15 years ago, but now it's available. It's commonplace. You can order, anybody can order these tests. And then you can look at it. You can actually look at the ratios, the progesterone estrogen ratio, all these different testosterone levels, all these things you could actually evaluate and find out what are the ratios and what the levels are. Are they healthy? Are they not healthy? Whatever it is that you find on the testing is what you treat.
And do you treat many women with PMDD, so premenstrual dysphoric disorder, where it's not so much a hormonal imbalance, but it's that sensitivity to the fluctuation in progesterone?
That's very interesting diagnosis of PMDD. I know people kind of psychiatric evaluation and they kind of give a label to the person and kind of give all these different reasons of why you're doing this. But what I find treating so many patients, I don't really, I don't care what your label is. But when I test you and I see there's discrepancies in terms of the balancing, I would balance your hormones and see what happens to your PMDD. It's really simple. It's like proof is in the pudding. Why don't you do the actual workup and actual treatment and then see? Because I think it's just, I don't agree with particular labeling of women for certain things, and it puts like a kind of taboo on it, that there's something wrong with your head. There's nothing wrong with your head. All you have to do is just balance your hormones.
So I guess what I'm asking is more if their hormones are within normal range, but from like in that luteal phase, if they are suffering from like depressive thoughts and deep emotional discomfort, can the bioidentical hormones help treat that side of things, or is there?
Absolutely. Yeah, absolutely. I've never failed, knock wood, I've never failed a patient that complained of whatever they complained of. And as soon as you balance the hormones, sometimes you need a little bit more progesterone, for example, than what the numbers say on the blood test or the urine test, whatever. And once you balance those out to the degree that person is now being able to operate optimally in their life, I think that's what matters at the end of the day. Right?
And I guess I want to sort of wrap this up talking about the role of stress and adrenal health and how that plays
Yes.
out
Yes.
in hormonal balance.
For
So,
sure.
yeah, could you shed your wisdom on what role stress and adrenal health plays in our hormonal balance?
Yes, actually, that's a good question because when we talk about bioidentical hormones, people are confused about the fact that it's only about the female hormones, which is not true. It is the whole endocrine symphony that we all have. And it has to play together because you can't just have one instrument or two instruments playing and the rest are silent. No, it doesn't work like that. So we test for everything from the top to the bottom: pituitary, your thyroid, your adrenals, and your ovaries. And then whatever we find. So I think that's a great question because most people get stuck on just the female hormones. But the adrenal health, it's the key. It's the key. The stress, so there's two things. There is a mental stress, right? But then the stress actually affects the body. So then the body kind of gets all these deficiencies. For example, if they use too much of the cortisol, then now they have low cortisol and they will be irritated from the cortisol being low. So there could be coexisting multiple hormone imbalances. So We just find out what are your symptoms, what's happening. And then based on the testing, we do all types of testing for adrenal gland, for example. We test saliva. I trust the saliva more than the blood for the cortisol levels. Because the moment the person brings a needle close to you, your cortisol jumps up right away, right? And so I think it's not reliable to do the blood test. So we do the saliva test and we check cortisol levels, 4-point cortisol morning, early morning, and then late morning, afternoon, and then at nighttime. So we can see the diurnal rhythm of your cortisol and then also the DHEA, which is the other hormone from the adrenal gland. And so, yeah, it's very, very important. So we treat that alongside with the female hormones and alongside with the thyroid hormones. So let's say somebody's 35 years old and they're having PMS, they're having irregular menstruation, all these things. It's very important to check thyroid because the thyroid gland affects the ovaries and it can make the menstruation irregular. So there's many things that you have to evaluate and then see what is exactly the symptoms the person is experiencing. And then based on that, you correlate that with the testing. And then you treat the person in the right order.
And do you have any advice for women who are in that perimenopausal to menopausal phase on how they can support the health of their adrenals and thyroid?
Yeah, I mean, if you're talking about the natural remedies, if you're talking about the natural remedies, there's plenty, and I think you know more about them than me. Since you're doing Ayurveda, I think it's awesome. But we have a formula that we use, and it does have many, many different herbs. And these are Indian herbs that I do use. Gotu kola, ashwagandha, all these different, magnolia bark. There's tons of them that you could use for adrenal health itself. So you can pick and choose, but I have created a formula. I call it Angel Calm, and that really helps people calm down. And it's all herbs. There's just herbs in there.
Beautiful. I guess just those lifestyle things of like being able to manage stress because, you know, that's when cortisol's really working. So being able to, yeah, manage the stress and diet.
Oh, 100%. 100%. I mean, I think many times it happens that, we get very busy. We get super busy, and there's lots of projects that are like not completed. There's actions that you start and you didn't finish, and those weigh very heavily on the mind. So when the patient tells me they can't sleep because they're thinking and thinking and thinking at night, so my usual recommendation for that is that, okay, so all you have to do is take a piece of paper and a pen and write down what are the cycles or the cycle of action that you have not completed, and that you will complete. So if you put everything down that's in your mind down on the piece of paper, you can get release. You can feel better because now you know what the things are that you have to do. So it works every single time. It's fantastic. It's easy to do. Just do it and see how it works for you.
Absolutely. I vouch for that. I do that every single day. I have to. My
Yes.
pizza routine needs to have a list that I know I
Yes.
can address the next day. And so, where do you see the future of hormonal or hormone therapy and functional medicine heading for women's health?
I think it should be at the forefront. I think in about 50 years, it should become the mainstream
Mm.
that people should not be given drugs for whatever they're suffering from. And not just the HRT. I mean, the other thing is that the hormones are very important, that they play a big role in immune system. So when you are middle aged, you can have like an autoimmune disease. But the hormones are playing a role in it. So if you balance your hormones, your chances of suffering from an autoimmune disease reduces. The only reason I'm saying this is from experience. I have clinical experience doing this. And many, many patients are grateful because now their hormones are balanced and their autoimmune disease actually goes in the background. It's not bugging them constantly and being in the forefront. I see that. I really wish that this becomes a mainstream. So patients feel sick, they should see a functional medicine doctor, which will become a mainstream doctor. And then we will use natural hormones, natural vitamins, natural herbs to help patients.
Beautiful. And if there is a woman listening to this podcast and they're resonating, but they're still a little bit hesitant about HRT or bioidentical hormone replacement therapy, we should probably say, what advice would you give her to help make an informed decision about her hormonal health?
Well, it's really interesting that there's so much data and knowledge available on the internet that you can actually research anything. And if you are still questioning, I think they just have to evaluate the data. From where are they listening? What is a source of information? So if
Mm.
they go straight to the information source and see if it is reliable or not, because there is lots of misinformation on the internet. Dr. Google is good for certain things, but sometimes it gives you the data that's not true. And so I think you just have to kind of really be informed and you have to really know the source of the
Yeah.
information.
Absolutely. I totally agree with that. I think people are so quick to, especially ChatGPT and things like that, quickly collect the information that they want to support their evidence. But if it's not a reliable source, then it's not actually information. It's not wisdom. It's maybe information from somewhere, but it's not true wisdom. And I think that's one of the biggest things when I went through my master's degree is really discerning what is reliable information and what reliable sources you can get that from and through different ethical studies and stuff like that. So yeah, always check the source that the information is coming from. I mean, even podcasts, like, go check the information we've given you. Like, always check from reliable sources, which we are, but go and do your own research. So thank you so much for sharing all of your wisdom. I've learned a lot from you. I've really enjoyed this conversation, and I hope that it's been able to support women out there on their journey, especially through that perimenopause to menopause phase. Where can our listeners connect with you, learn more about you and what you do, and more about bioidentical hormone replacement therapy?
Well, you can go to my website. It's angellongevity.com. And to learn more about bioidentical, I would think I don't know other websites that are totally reliable or anything like this, but I would look for a doctor that has experience treating patients. It's like I said, the proof is in the pudding. So if you find a practitioner that has treated many, many patients with good results, then you can trust that person and depend on that person to guide you correctly, I would think.
Well, thank you so much. We'll pop your link in the show notes. And thank you, everyone, to listen to the podcast. Until next time, honor your body, embrace your journey, and step into your higher self.